Hello and Assalamu alaikum to you all. This is Maria Abdul Wahid, intern at MedAngle, and I welcome you all to another episode of It's a Math Specialty Series with MedAngle, a deep dive into different US specialties. Today, I have co-host with me, Robazaya.
Good evening and Assalamu alaikum everyone. My name is Rabazia. I am an executive associate here at MedAngle and a final year medical student at CMH Lahore. We are all so excited for this conversation. Before we begin, I would like to request our speakers, Dr. Poombal and Dr. Bushra, to please introduce themselves. So starting with you, Dr. Poombal, could you please introduce yourself?
Hello, thank you for having me. I actually have single name. Second is that I graduated from Nishtar Medical University in 2021, and my pathology journey spans in Pakistan as well as in US, doing observership, researches, internship, and what excites me about pathology that it directly influences the patient care. That's something.
And Dr. Bushra?
All right. Assalamu alaikum, everyone. My name is Dr. Bushra. I'm from Dow Medical College, Pakistan, and I am a graduate of 2018. What's exciting about my journey is that throughout the years, I feel like, I was driven towards pathology. It was just not from the beginning. And time by time, I progressed. And the one thing that was key to my experience was my home country residency, which helped me tremendously in everything. So yes, that's one exciting thing.
Okay, we are very excited to have both of you here with us recording this session. I'm sure our audience will derive tremendous benefit from it. Like Dr. Poombal was saying, pathology is often described as the cornerstone of modern medicine. It involves diagnosing diseases by examining tissues, cells, organs. Dr. Poombal, can you share one unique thing about your journey? How has it shaped your career?
What actually drove me towards picking pathology, a specialty in US, is that in my third and fourth year, I used to dread memorizing those morphologies because they felt very one-sided. You are looking at a picture and you're memorizing this nuclear size. Oh, this is how large they are supposed to be, and these are the peptides, and all of those felt very one-dimensional. But I did pathology in my house job, and I would say medical college gave me that opportunity to have actually hands-on experience, which made me pick that specialty because I liked how we were interacting with the patients and making diagnoses that were affecting the patients, and sitting in the tumor board. And I realized that that is going to be my future career, or my future specialty, because it will allow me to work as a scientist, as a healer, and teacher. So that's why I picked pathology.
Wow, that's just so inspiring. That's great. Dr. Bushra, you mentioned in your introduction that you did a home country residency. Would you characterize that as a career highlight?
All right, so I'll tell you exactly what my career highlight was. I initially planned on doing internal medicine, and I was doing a job as a medical officer in the oncology wards and in Pakistan. And over there, I was attending the tumor boards, and that's when I realized that who is this doctor who's dictating all the treatment options for the surgeons and for the physicians. And that's when I realized that the pathologist is so essential. And that's how I started developing an interest in pathology. And I decided that this is what I want to do because it's so, firstly, I love it because of the fact that it has the most amazing work-life balance. And I felt like that's what I want to do I want to be a physician, but I also want to have time off and relax and enjoy. So then I did my residency. I started my residency. I did my FCPS exams and I started my residency in Alhan. And Alhan has the biggest histopathology unit in all of Pakistan. It's a referral center. So there I saw cases and it has the hugest faculty, and it was amazing. Like, that experience was amazing, and particularly because of the fact that it is CAP accredited. So everything was referred back to the US, and they were the ones who were like pushing me that if you've done your steps, you've done everything, you need to apply for a match in pathology in the US. And at that time, I didn't even know, how the career options would be, but I applied for it and I got in just based on that fact. I did not do many observerships. I did not have a lot of experience in pathology, but it was just that 1 year of residency in Alpha that changed my life. So I would say that was it.
Wow. Wow.
All right. With that, let's jump into one of the most important parts of your application, that is building an office. You know how CV and personal statements are like your personal story and showcases all your hard work and achievements in medical field. But for those interested in pathology, Dr. Bushra, if you could share your insights on how they can build a strong CV and what the key components that one needs to focus on when applying for a match in this special.
Okay, perfect. About my CV, I would say that research is very important, and research doesn't have to be an original article always. It can be case reports, it can be case series. So when you actually start doing an observership or a medical officer position or a residency or anything you want to do, try to get in touch with the faculty and try to get a case report or some case. You should just show your interest in research, and most of the time I will tell you that they will do more than half of the work for you. You don't even have to do that much. You just need to try to be interested. That's it. Trust me, they know their stuff. They're going to get it done, but they need some interest. They need the person to be actually interested in it. And when I wrote my first case series, so I will tell you that, to be very honest, I told my professor that I'm not sure if I can write anything pathology related because I've never done it. And he said, don't worry about it. And he just told me to, work on the data and the statistics portion. And he did most of the writing part. And that's how I learned. And then I was able to do it the next time. So to be very honest, they just need somebody who's interested to learn, who's sincere. That's it. So you start building your CV firsthand with research. And research, even if you're not sure about pathology, it doesn't have to be pathology specific, but you have to do research. That's a key all through your medical school, and even later on, if you decide on it later on, that's fine, but you need to do research. Secondly, I would say yes, observerships do help, but if it's possible for you, it's fine. Not a lot of people can afford it financially in these times in the United States. So even if you don't get an observership opportunity, it's okay. You start working in your own country, either as a medical officer or better yet, as a resident. And trust me, that's going to help you a lot because, initially I didn't even know about it, but after I came here, I talked to a lot of people and they said that they had done their FCPS training back in Pakistan in pediatrics or any other specialty. And when they came here, they got waived a year off from their training. So it's not nothing. Even if you complete your FCPS, trust me, it's not nothing. It's going to help you a lot in the future. So yes, I would say that the research part and this part, and for LORs, try to be nice to everybody. Just say Assalamu alaikum, good morning to every single person you meet in the hospital, and just don't you don't even need to have a conversation with them, just salam. So eventually when the time comes and when you go to them that you need a letter of recommendation, you at least, they know that they've seen you. If they've not even seen you and you suddenly go to them that I was a resident or I was a medical officer and can you please write me a letter, they're going to be like, I'm looking at you for the first time. So just try to be nice to everybody, very cordial, and that's going to help you out.
Great. Dr. Poombal, if you'd like to add.
Yeah, I do agree that home country residency is very important for pathology, but what they are going to see is that pathology is not like other clinical specialty. They want to know that you will be okay with no patient interaction or bare minimum patient interaction, and what it might be that you will have for long-term career commitment. And other thing is that Bushra also mentioned that you should know how to write a case reports. That is like essential. And you can present those case reports in CAP, ASCP, and that could help you make connections and which will eventually get you interviews. So basically this, and you do not need postdocs in pathology. That, but simple experience of writing case report will help you a lot. And another thing that I was looking at when I was interacting with the people during interviews was that they had very pathology specific hobbies, like they like photography. And during pathology, you're looking under microscope. You love to take pictures, and they love to draw. Pathologists love to draw. And for instance, I love to watch crime documentaries, horror movies, and that is a component linked to pathology that are very investigative in nature. So this is something I would say fun part of being pathology. It's like I would say, personality trait. Yeah, that's it.
Oh, Dr. Poombal, so building on to the discussion of USCs and observership, we all know the role they play for someone applying for IM or for surgery. Like there are certain skills that you want to be highlighted in your skills. And also, we all know the role a patient-doctor relationship plays when it comes to LORs and CT. But when it comes to pathology, it's like entirely a different world. So what would you recommend? What role would you recommend for students interested in pathology to get involved in, considering how less patient-doctor interaction there is in this field?
I thought, okay. So how can students get involved is that they can ask their professors to let them rotate in labs. uh, for compulsory, I would say a week or 2 week rotation in labs, and they get to see what how the tissues look like, basic simpler tissues look like under microscope. And we do have similar things like in histology classes. We were made to look under some slides to see how normal tissue look like, and that could also develop on in our later on pathology years. We can be looking at certain morphologies of tissues and diseases so that they develop interest how it is going to be. And other thing that is different from Pakistan to US is that they also do autopsies. So you can rotate in forensics to get some basic know-how, or I would say exposure, so that you know what you're getting yourself into.
Great, that was very informative. So let's move on to the next section. Robust, if you like. Thank you.
Now that we've covered the basics of pathology and CV building, let's talk about what the match season is like for those pursuing a career in pathology. This can be a really stressful but also really exciting time for medical students. Dr. Poombal, can you share some insights on what medical students should expect during match season specific to pathology?
So, what I am going to highlight are the few facts that there are limited seats in pathology as compared to other specialities. So, this makes the lesser number of seats in candidates, greater ratio of candidates makes it a competitive specialty to apply to. So, also we have to prepare for specific questions. If you are resident, they ask you which tools do you use, how do you graph a certain specimen, and if you did a rotation in, for instance, lab or forensics, they are going to ask you again very specific question. Did you see AML cases, or were there MRD cases? So you have to prepare, be very specific about your past experience. They are going to question you in very specific questions, which might feel like, oh, this is like my viva being taken. And other thing that I would like to add, that try to do your rotations in IMG friendly programs. Again, this is like bread and butter of every specialty you are applying into, so that you can enhance your chances. Once they see you in lab, they see your passion, they are going to give you interviews, they are going to eventually keep you in their program. And one red flag that I would suggest you avoid is, do not make your CV cluttered with confounding experiences. Just stick to one. So if a PD sees that you have put multiple experiences and you're not sure, and it seems like you're applying to pathology as a backup and not your main specialty, they might rank you lower in their list, and this will work against you.
Right, right. Okay, yeah, no, that's a very good point. So one shouldn't go into pathology thinking of it as a backup specialty, right? Of course, of course. Dr. Bushra, could you elaborate on the interview process and what are some key points that candidates should keep in mind?
All right. So for the interview process, firstly, let me tell you, do not look at the number of interviews. Pathology has very less spots. So it's not like I am. So you're not going to get like 20, 25 interviews and then you're like, okay, maybe I'm safe. No, it's not going to be like that. 2 to 3 interviews is still good enough. Trust me, it's good enough. I had 3 interviews and I matched. So don't worry about it. Don't worry about the number of the interviews, firstly. Secondly, it's always better, I feel personally, that if you get an interview by, randomly through merit, and in terms of getting it through networking, because I thought that I matched to a program without any connections, and there's not been any Pakistani in this program. It was only through pure merit. So trust me, it's gonna be, firstly, it's luck. Secondly, you just believe in yourself. You have a good CV in terms of you're sure that you want to do pathology. How are you sure you want to do pathology? Okay, so my CV was very scattered because I initially wanted to do internal medicine, right? So it had a lot of medicine experience and, pediatric medicine and stuff like that. It had nothing related to pathology. But when I started my residency, that was it. Because they were like, if you're in a residency over there, that means you're committed. That means you want to pursue this. And that was my selling point. I did not need a lot of experience in pathology or any amount of research, LOR, or anything in pathology. It was just that I'm in a residency, I'm looking to be a consultant pathologist, and that's it. So even if you have a scattered experience from your past, that's fine. A lot of people do have it. But once you think of applying, you need to be very clear that you want to do a specific specialty, either pathology or medicine or whatever. It has to be very specific. And secondly, what I think that you should always, that should be the selling point, is that don't be intimidated. Pathology does not have a lot of Asians right now, but there's a dearth of pathologists in the United States. And people, even without doing fellowships, they're getting amazing jobs right now because everybody wants a pathologist. There are hardly any positions, residency positions for pathologists, which are only 628, which is not even quarter of the amount for medicine or surgery. So trust me, you're going to get a job. That's not going to be an issue. The jobs are not going to be an issue. The future fellowship opportunities are not going to be an issue. They need pathologists right now. So don't worry about what's going to happen in the future. When you think about pathology, trust me, it's going to be safe future wise. And I'm also learning. I just attended a dinner yesterday with all the pathologists in my program. And trust me, that's when I actually realized that I don't even have half of the knowledge that I did, because I was like, okay, what is going to happen with the J1 visa on pathology and stuff like that? Don't worry about those things. Trust me, it's safe. It's very, very safe. You're going to get a job, and a very well paid job at that. So don't worry. Just trust yourself. Even if your CV is scattered, you sell it. You sell it like you love yourself. You need to love yourself first before you expect them to love you. So love yourself, sell yourself, and they're going to be down with confidence, because that's one of the things that the interviewers told me, that the reason we picked you and the reason why we were so interested in you out of everybody was that you thought about what you were about to say. You were so committed and you were so confident in yourself that you can do it, that we were sure that you can do it. So trust me, you can do it. Get a good CV and love it like you love yourself.
Sorry, I'm cutting you. I want to add something to it. Since there are lesser programs and like almost 100 and 105 programs, if you are fresh out of med school applying to pathology, try to limit them to only 100. And if you are, for instance, 4 year out of med school or 5 year out of med school, do not apply to more than 60 programs. So you are going to get matched out of 60 programs or 100 programs. That's why I would say money saving tip for applying into pathology specialty.
Right. Okay. Okay. That's very nice to hear. Dr. Poombal, do you also have any specific points on how to stand out? So how Dr. Bushra mentioned, she had residency, lots of her co-residents have, home country residency experience. Is there anything you felt was really could really help a potential candidate stand out throughout the interview process?
Yes, I agree. The biggest thing in your CV is residency, as Dr. Bishop mentioned. There is no lie, no second opinion about that. Once you have that in your CV, you are getter. You will go get the position. So for pathology, they usually look at your past experience, and if it is in pathology, you are definitely going to get the job. So I wholeheartedly agree with what she said.
Okay, okay. And lastly, what advice would you give to that poor candidate who's overwhelmed by this entire process?
Oh, so if somebody is feeling overwhelmed with the entire process, the thing is, some things are not linear, right? You might be getting very good marks, good interviews, but some things out are sometimes are out of your control. So you let the things happen at their own pace. You are going to get there. Stop comparing yourself, because comparison is the like killer of your happiness. Is going to ruin things. And find some support system around yourself. Your family, your friends, your spouses could be your biggest support system, and that is going to help you get through it.
Right. Okay. Thank you so much, Dr. Poombal. I mean, the match process can be incredibly challenging, but like you said, with the right mindset and preparation, anything's possible. Right?
Yeah,
Yes.
thank you so much, Dr. Poombal, Dr. Bushra. They were actually really, really great points. And I love the fact that there are so many things that one can do and there's so many things that one must avoid. But at the end of the day, you just have to believe in yourself or what you have. So I really love this idea. So now let's discuss another aspect of this field, focusing on this. When someone is considering any field, there's so many questions that comes in mind. Like if we consider a medical student, one of the major things that comes up is like, what will be the scope of the field I'm choosing? What will be my fellowship options? What kind of subspecialties one can offer? Or what are the other possible career pathways that one can choose? So, Dr. Bushra, if you could give us an overview on that.
So for the fellowship options, it's a bit different. The process is a bit different for pathology. You don't necessarily have to apply through ERIS. It can be, it has to be specifically to other programs, and then you have to send LORs separately to all of them. But trust me, your program is going to help you with all of that. Don't worry about it. J1 visa is not an issue because in the program that I'm in right now, I have a lot of international medical graduates. They're all on J1s. They're all getting their visas for their fellowships. And these days, people do double fellowships in pathology. So that is the recommended path. If you do double fellowships, that's good in terms of private practice, and also in terms of if you want to have go towards the academic side of medicine. But you need double fellowships, and everybody's getting it. Trust me, they're all on J1s and they're all getting it. So the visa is not going to be an issue with the fellowship. Secondly, even if you don't want to do a fellowship, you can easily get jobs just as a pathologist in the US because everyone needs them. Everyone needs a pathologist for their private practice. If they want to set up a lab, they need a pathologist. So you're going to get a job. Secondly, I would say that I wasn't really sure of whether I want to do private practice or not. In terms of, if you want to pursue the academic side, you can help people back in Pakistan. You can help them come to the US. So that's always a preference. It's a bit lesser paid as compared to private practice, but it has more prestige. So that's up to you. And thirdly, with digital pathology right now, you can work remotely in wherever you want. So if I'm here right now, and if I apply as a visiting faculty back in my country, and they can easily scan the slides and send them to me, and I can send them reports, and I can get paid for it. So it doesn't have to be, like it's easy. You can work in multiple places, and there are a lot of career options. With digital pathology, you don't even need to be in your office. So it's good. Trust me, the career options are blooming for pathologists now.
And that was interesting. Dr. Bombay, if you'd like to add on.
Yes, I agree that career options we have in pathology are diverse. You can go into clinical side, you can go into research labs in pharmaceutical industry. That is the less discussed part of pathology, and industrial pathology, that those are. And then you can also go into academia, private practice. Private practice, again, I agree, pays more. Other thing is that since the number of fellowship positions are more than the residency spots, so you can easily get any fellowship you want. Again, highlighting that you need to do 2, 3 to make yourself marketable, because pathology in US is different as compared to Pakistan. You do 2, 3 months of rotation, then you move on to next. You are not doing that as same subspecialty, for instance, heme path for 4 years like you do in Pakistan. So So to develop, I would say a more better training, they do two at least fellowship. Now coming towards J visa, CAP, that is College of American Pathologists, have been advocating that there is a shortage of pathologists. And they are in J1 visa, there should be more waivers. So right now, the market is like very demanding. All of them are getting it. We don't know how the market will pan out when once we grad, but we can hope for that. But and about the digital pathology, the thing is, the Chuktai lab in Pakistan is CAP accredited, and Dr. Umar Chuktai is actually a visiting faculty. So agreeing with the fact that this happens all the time, that he is a visiting faculty or remote faculty of UT Houston. So again, you do not need to be physically present if the program has digital pathology installed. Like Canada has all of the programs are digital pathology. US is now converting towards digital pathology. Some of the programs have it. Some are trying to buy that tech. So eventually, this will solve the visa issues. Even if you are living in Pakistan or you are living in Florida, you can still sign out cases in West Virginia or California. All of these distances can be reduced, and visa issue will be less of a problem once that settles in.
That was actually really enlightening. So another thing that obviously plays a significant role in choosing a specialty is the lifestyle and finance. Like I'm pretty sure someone in our audience was reporting how pathologists are compensated as compared to other specialties. Like, is it a high paying field or is it a low paying field? And also, how are the working hours and how is the work life balance for a pathologist? So, Dr. Busha, if you could elaborate.
Okay, so the work-life balance, firstly, it's better than any other specialty because there are set working hours, except for when you have frozen calls, then you don't really know. You're banking on the surgeon. Whenever he has a surgery, then you have to wait around. That's once in a week, sort of. So you don't have to worry too much about that. Most of the time, it's set, it's 8 to 5. It's a regular day. That's it. That's all you need to do. There are no crazy working hours. You can hang out at night. Secondly, the thing is, we have 5 working days a week as compared to other specialties that have 6 working days. So that's also a little bit better. And about the pay, so it depends. It depends on what you choose in the future. If you choose a lucrative specialty like GI pathology or GU pathology, that pays a lot. But if you choose something else, that's also fine. The thing is, to be very honest, I don't know if you guys remember there, but there was a seminar in Dow, and everybody was like, "How much are psychiatrists paid?" Or, surgeons, and what's the difference? Pay difference. The baseline pay for all the physicians is going to be 6 figures, 2 mils basically, and that's the standard. You can go higher than that, but it would not be lower than that. So you don't need to worry too much about the pay. It can be higher, obviously, if you're a surgeon and if you're working 24 hours a day, you deserve to earn more. And if you're doing private practice on that, of course you do. But trust me, for a very easy work life, you can get paid as a pathologist very well. And plus, if you set up a lab of your own, then the amount of pay I can't even imagine.
And thank you so much for the detailed explanation. Dr. Poombal, if you'd like to add on.
I agree. The working hours are pretty, once ending, the working hours are like the banker's job. You come at 9, you go at 5. Residency is hard. You need to study. It's a, I would say, very bookish specialty. You have to read a lot to be a pathologist. And a lot of physicians rely on the diagnosis. So, and once you get done with your residency, your fellowship, you get into a pretty easy lifestyle, and pay is like in between and not too high, not too low. So you're pretty set for life.
Perspective.
Okay, all right. Thank you so much, Dr. Poombal, Dr. Bushra, for your time and for sharing all these valuable insights and experiences with us. This has been an incredibly informative session. I, for one, personally, am quite sold on pathology. I've learned so much from this conversation, and I'm sure our audience will, have had most of their questions answered as well, right?
I hope so. I hope so. If you guys have any other questions, you can always reach out to us and you can share our emails with them.
Oh, Okay, before we wrap up, what is one piece of advice that you'd like to share with all the future pathologists out there? Let's start with you, Dr. Mohammed.
So the thing is that before applying, you have to know your specialty. And if you pick pathology, you have to talk to current pathologists who are practicing in US to let you know what are the advantages and disadvantages of it. And once you pick it up, it's a lifelong learning. And that's the best thing about pathology is like you will be a lifelong student.
Dr.
I would say one thing would be that okay, you need to be sure when you go into pathology, you need to be sure that there's not going to be patient interaction, and you need to be comfortable with that. But trust me, if you value yourself and if you like a good work-life balance, this is it for you. And also because of the fact that you get all the benefits just as a physician. It's just that you don't have to deal with patients directly, which is, I feel it's better, it's more comfortable, but to each their own. So that's one thing, just think about that. But apart from that, trust me, it's mostly books, it's safe. You don't have a lot of liabilities, so it's not that stressful all the time. You're not worrying about like there's a patient in the ICU, or like did I put the mask on that patient and stuff like that. So it's more comfortable, and it's worth it.
Thank you so much, Dr. Bashir. On that note, we are bringing more episodes of It's a Match Specialty series. So stay updated with us across all our socials. Follow us on our Instagram, Twitter, LinkedIn, and subscribe to our YouTube channel. We'll see you another time. Allah Hafiz.